once again, thank you everyone for taking the time out to join us today. My name is Obi, and this platform is called The News with Obi. I am a political commentator, news reporter, producer based in the New York City area, actually in New York City. The platform is called The News with Obi because I talk a lot of politics. We talk about current affairs and things happening in our local community and around the world. And I figured that today's show will be very important to me because, like most of us here in the States, I still have a lot of family in Nigeria. And whenever I call them, they didn't seem to know what's going on with the coronavirus. So I figured it would be better if I could talk to a professional, a doctor on the front lines to help us deal with this. So Dr. Foluke, tell us a little bit about yourself.
Yeah, okay, so Foluke Olaniyi-George.
Reduce
I'm a family doctor.
Mm-hmm.
Okay, up or down? Reduce it?
That should be good.
Okay, yeah. All right, so I'm a family doctor. I'm actually a member of the West African College of Physicians.
Okay.
And I have special interest in child and adolescent health. I have an MPH in child and adolescent health, and I'm a private practitioner. So essentially, I'm a frontliner, you know, in the fight against COVID-19.
Exactly. And people on Instagram, can you hear us fine? Please let us know. If someone can let us know if you can hear us, that would be great. So, Doctor, talk to us a little bit in an effort to actually flatten the curve in Nigeria. I know Nigeria has set up some containment centers. Yeah, okay, thank you. The doctor that I had, Dr. Okuchobona, is saying that they can hear us fine. Okay, great. So in an effort to flatten the curve in Nigeria, I know Nigeria set up some containment centers. How efficient have those centers been? I saw a video this morning about a containment center, I don't know where, but it seemed like people weren't really practicing social distancing. So talk to us about how many of those containment centers they are, how efficient it's been so far.
Okay, thank you. First of all, it does seem to appear that in the early days, you know, of the pandemic and its presence in the country, there was a very robust response by the NCDC, which is the organ, the parastatal that is charged with overseeing the response to the epidemic. And because of the fact that Lagos was the portal of entry,
okay, right,
and was the state in which the first case was actually identified, you know, and Lagos has a history of responding well with public health. You know, remember the Ebola epidemic, you
exactly.
know, and the response of Lagos State, which was actually seen as practically a model for response to epidemic all over the world.
Right.
You know, so yes, there was initially a very robust response with the building and creation of isolation centers, mm-hmm. where people who are actually confirmed positive,
right,
you know, were kept. Okay. Now, the country has quite a number of isolation centers. I'm not sure right now of the exact figure, but okay. virtually in every state, as a response to, you know, the growing needs and confirmed positive cases all over Nigeria, each state has, you know, been mandated to create centers. Some initially started off in existing facilities, and then those were like temporary isolation centers, and then they had time to create, you know, purpose-made and purpose-built isolation centers. In fact, the private sector has also gotten involved, especially in Lagos State, where banks and private organizations have collaborated to build isolation centers. But with respect to how effective they have been, there's still room, you know, to watch and to score.
Okay.
And this is exactly for the reason that you mentioned, the fact that you have a number of facilities that have been created, but the facility is not going to run in isolation.
Right.
There must be people to man those facilities, and they must be equipped.
Right. Right.
You know, and this is one challenge that I know we have yet to, we have yet to overcome. The main problem now we're seeing, is in the northern part of the country. And this is a part of the country that even before the pandemic came on ground, we are challenged with respect to the number of doctors or the ratio of doctors per, member of the population. Right. In some cases you have so few doctors that other cadres, of healthcare workers have to actually stand in the gap because, there can't be a vacuum. People need healthcare,
Right. So are you saying, would you say that the numbers that we're seeing now being reported, are those numbers accurate, or would you say they're being underreported?
Well, with the no, you see, the issue that we have with Nigeria presently, actually have an idea, of the actual number of cases. Now, take, if I may mention the case of Kano, recently, tests were not being carried out sufficiently, and it took grave diggers to report an increase in the number of graves that they had to dig, before there was an alarm raised as to, what is the cause of these so-called mysterious deaths. You understand? So you
speaking of mysterious deaths, I know in a country like Nigeria, we have a huge population. How has the government, or is the government helping people in the rural areas when it comes to social distancing, washing hands and using hand sanitizers? How has that been enforced, if at all?
I am not happy to have to say that it is not being well enforced. Several videos have surfaced where journalists will go into rural areas, even to ask the rural people what their understanding level is about the pandemic and about the disease itself, and it's virtually zero level of knowledge, you understand? So we really need to do more with respect to engaging people on the ground. It's good to have your plans and your models, but you need to actually connect with people to make these things work.
Right.
Exactly. Yeah.
Right. And I know Ebola kind of prepared Nigeria for dealing with pandemics, but Ebola actually was just in Lagos. It did not really spread like that. So had it been Ebola spread the way it did in Sierra Leone, Nigeria would have been in a much worse position, right?
I agree, 100%. And that's why, again, we were excited when Lagos State, was the portal of entry of this particular case. And we felt good about the fact that Lagos State was up to, the task. They were going to be able to crush it early on. But, in this case, it needed more than a state effort.
Right.
We needed more of the federal might to be behind Lagos State. And I think Nigeria started a bit on the back foot with respect to the national response to this pandemic. For instance, there was almost a full month between the time where we identified the first case,
which was
and the time that our international borders were closed. Right. And the virus doesn't move. We all know that. People move it. Right. So in as much as you have people that are transiting and moving from one place to the other, the virus is going to move with them. So moving from very high density infection areas into Nigeria, it's a no-brainer. Nigeria was going to, be a receptacle, one way or another of the virus.
So for those that are just joining us, thank you so much for taking your time out to join us on today's show. Again, I think this is very important that we get to speak to a doctor, a professional on the front lines to tell us how we can better deal with the coronavirus in Nigeria and how dealing with it has been going so far. If you have any questions, please type it in the comment section on Instagram, and I'll read it to her, and I'm sure Dr. Foluke will be glad to address that. In the meantime, let's talk about the small team of Chinese medical specialists that came to Nigeria to deal with COVID-19. I know they were met with some kind of aggression, and the hardworking doctors in Nigeria like yourself, they're not like that. So talk to us about how that even got approved to begin with.
Well, I mean, as with many things in Nigeria, there's a lot of everything is blurred. A lot of secrecy. Of course, the federal government came out after there was a loud outcry against that visit by the Chinese nationals, and eventually, I believe one of the things that they said was that these, of course, they're doctors, but they're not only doctors. Some of them are technical staff who are coming with equipment, and these are expensive equipment that will need skilled hands, so that they probably are not coming to act in a medical capacity, But I mean, the approval for a doctor not trained in Nigeria to work in Nigeria doesn't come from anywhere else. It should come from the Medical and Dental Council of Nigeria. Right. So unless they were approached, then I will say that the federal government probably acted ultra vires, But if
are the Chinese medical team still in Nigeria right now?
Well, to the best of my knowledge, they are, because the Nigerians, insisted. I guess that probably was a plan of the government to keep them under quarantine for, the statutory 14 days, after they came. And nothing really has been said, about whether they are still in the country or in what capacity they have been. But, like usually happens, people have just gone silent about it when the government just won't budge. Mm-hmm. They insisted, they wanted them to come, and they came.
Well, I don't know. I would like to be kept up to date with any progress that they've made, if they're making any progress at all. Okay. But in the meantime, let's talk about chloroquine. We all know, we've heard that chloroquine has been used as, Trump, first of all, was kind of touting that a little bit. He must own some kind of stuff with chloroquine, and I understand people rushed out to go buy some chloroquine, and actually I don't think it ended well. So talk to us a little bit about that. Growing up in Nigeria, I was injected with chloroquine quite a bit when I had malaria. So is that something that is being used in Nigeria right now to deal with the virus?
Okay, thank you. This is a novel virus, a novel disease, and of course there is, there are a lot of questions. What are the effective treatments that can be used, especially considering the fact that, everybody knows the case fatality rates and the age group in which this is more likely to happen. Mortalities are likely to happen. So I remember in the early days of the pandemic, in Nigeria, there was a rush on chloroquine here too.
Right.
Yes, people hurried to go and stock a drug that had almost been, confined to the dustbin, because chloroquine is not even used in treatment of malaria anymore here. And suddenly became hot cake. Yeah, so it suddenly became hot cake. In fact, I personally got a number of requests for prescriptions, for chloroquine, and I'm like, chloroquine is not, it hasn't. There are stages, there's procedure to approving a drug as treatment for a disease,
right?
And chloroquine hadn't gone through those stages, those trials.
Exactly.
And a lot of people have conditions for which chloroquine is, right? So that had to come into the counseling, a lot, because of the initial fear, right, of the disease. Now, coronavirus is a virus. Okay, so it stands to reason that an antiviral agent is going to likely, show up as one of the major, if not the major treatments, for coronavirus. And of course, we know of the trials and the that are going on currently.
Yeah.
But as to what is being used currently in the treatment facilities, in the isolation facilities, again, there is a little bit of secrecy. We don't get to see what happens in the isolation facilities or the very ill patients, and this actually contributes to the distrust that the populace have, because one day you'll say so number of people were confirmed, this number discharged, and suddenly you say this number of people died. What happened between their confirmation and their death? Nobody knows.
So there's no real accountability or real.
No, but off record, I can't tell you that a number of people who I know were positive did use chloroquine. I cannot say that it was effective, in their treatment. And there are lots of herbal remedies, that are making the rounds now. Very popular in Nigeria. Dogon mixed with dogon actually contains the active ingredients in chloroquine, quinine.
Okay.
Yeah. So and then mixed with lemon, mixed with lime, garlic. Put everything in a pot and boil it, and put a dash of one or two other things. And a lot of people, are subscribing to this. And this comes when there's a vacuum. Nature abhors a vacuum. So people need to know. People need to be informed, of know what is going on. What is being used to treat coronavirus in Nigeria? I cannot say I know. I know, for instance, what is being used to treat coronavirus in the United States, because people are talking about it. But here in Nigeria, we really don't know.
Right. And so if chloroquine is no longer used for malaria, and I didn't know that, what is being used for malaria now?
Okay, what's being used is now a combination therapy. It's called ACT.
Okay.
Artemisinin-based combination therapy, which artemisinin derivatives must be the backbone, and then combined with other agents, Okay. So, and that is a standard all over the world.
Okay, that's good to know. I had no clue. So if you're just joining us once again, thank you so much. If you have any questions, I see everybody coming in. I'm trying to wave at everybody on Instagram over here coming in. Thank you so much. If you have any questions, I'm sure you have questions, please feel free to type the questions in so that the doctor can answer those questions. So before we scheduled today's show, the restrictions being lifted in Nigeria wasn't as it is as of today. As of yesterday, I saw that major restrictions have been lifted in a few states, and it doesn't seem to be going so well. Even in here in the States, the restrictions being lifted has not been going so well. So social distancing hasn't been happening. Talk to us a little bit about that in Nigeria.
Okay, so the problem with social distancing in Nigeria as a means of flattening the curve is that Nigerians are not naturally socially distanced people. And I believe that as a public health specialist, I know that you must understand the culture and the way of life of a people, and integrate whatever plans you have, to fit in. Because if they don't accept it, if they don't buy in, then it's just not going to work.
But we know, like you said earlier, the virus moves around people to people, and I know our culture is not one of like being isolated or being socially distant. In your opinion, and anybody that's listening or watching, being a public health official too, in your opinion, what do you think, or how can we get this ingrained in our people that we have to social distance? And don't get me wrong, Nigeria is the most populated country in Africa, so it's hard, but what can we do to really enforce this if the government is not enforcing it?
Yeah, I mean, we can't do it in isolation. We can't do it without the government. The government just has to rise to the occasion. Okay. Now, social distancing, even as a matter of a containment measure, there are some places, for instance, that social distancing is even likely to, or a lockdown, for instance, is even likely to increase the rate of infection. For instance, you have a building, there are buildings in Lagos, for instance, where you have probably about 300 people living in a building, a single room with about 12 people. Now, if you say that there's a lockdown and everybody should stay put, and one person, a single person in that building, in that community, where they have shared bathrooms, shared conveniences, effectively you're saying that everybody in that place is going to be locked down. So again, like I said, the government does have to rise to the occasion. And this has to do with orientation, information. The people need to understand what exactly is being asked of them and why.
And why, right.
Yes, and then for instance, masks.
Yeah.
I was an early proponent of masks for everyone.
Yeah.
And this has to track down from the highest, person in government to the least, units or person in Nigeria. Everybody has to understand that the route of transmission of this virus, one of the main ways of attacking it is to ensure that you don't get your droplets, sent to anywhere, and you don't receive from anybody else. And having the mask in place, And so, I mean, if I know that I need a mask and I use one, and I insist that I'm a cashier at a bank, and I insist that the person that is coming to, transact her business with me uses her mask, and the next person does the same thing, then it's a spiral effect. We all, look out for each other.
So are you, because I know here in the States, there's some stores, well, almost all, you cannot go into anywhere without a mask now. Is that the case in Nigeria yet or no?
It is not the case. It's not being enforced. It's not being enforced. My mom told me that she could get booked, on driving in San Diego without, a mask.
Yeah.
That we need to get to that level.
Yeah.
And like I said, it's not just about the government and the police, but everybody needs to look out for the other person. And we can only do this if people know what, they need to know more. They need information.
Yes. So the information needs to be strategically communicated to them as to why this is important.
Yes. And, for a place like, again, Nigeria is not just, Nigeria is made up of different units. And we need to understand that having, understanding of the various units in Nigeria would also help with this. For instance, in the northern part of the country, which looks like it's already an epidemic for Kano, already the epicenter of the pandemic in the north.
Right.
You can't do anything if you don't engage the religious leaders.
Exactly.
You can't do anything successfully if you don't engage the village heads. Exactly. So these are the people that, and there's already an innate distrust of everything that comes from the West.
Exactly.
Of course, you most likely know of the insurgency in the north, and what it means, the Boko Haram, exactly. So if you can engage the major stakeholders and give them the task, of going to the grassroots, the federal government, NCDC can virtually leave it in the hands of, those people, and it will work like magic.
Yeah. Yeah, it never fails. Anything communication-wise, when it comes to a mass pandemic like this, you have to really start from the grassroots, like somebody mentioned. And I see questions coming in. Let me see if I can read some of those. Some you've already addressed. So Dr. Okuchi had asked earlier, Dr. Okuchi had asked, not sure, she said, not sure if I missed this, but what is the rate of testing and how is that being done? I know we talked a little bit about testing, but and you said that there weren't enough testing as of right now. The ones that are being tested, how is that being done?
Okay, so initially what happened was that it was there was the index patient, and they fanned outwards from the index patient. Now, eventually, we are at the stage where community spread is a real thing with us.
Right.
It's going to be pretty difficult to start saying just contacts of CDC changed the case definition. Being able to qualify to get tested.
Okay.
So they spread it, they relaxed it a bit, because initially you almost had to probably be a housemate with a coronavirus patient to get tested. The criteria was that you actually had to have had contacts with it. But you know how movement is. I can't even count the number of people that I have met or had contact with today. You understand? So of course,
and a lot of people are
asymptomatic.
A lot of people
exactly. A lot of people are asymptomatic.
Yeah.
You know that, and that's the big thing, because that is the point at which you need to get them.
Right.
And the issue of masks also will take care of the asymptomatic people who won't sit at home.
Yeah.
You know, and we don't have the economic wherewithal for a lockdown, so to speak.
Yeah.
The few weeks where there was lockdown in Lagos, in Oyo State, and some other states, Abuja, the rate of crime increase was astronomical.
One of my uncles in the East got kidnapped last week. And,
exactly.
And they were asking for 10 million naira.
They can't feed.
Yeah.
You know? So, and that's just what's going to happen if, you know, these issues are not taken into proper context.
Yeah. So let me see if we can get to some of these questions. Thank you once again, everybody. And everybody seems to be in line with social distancing. And somebody said, since people are not social distancing, can you speak to mask usage and hygiene activities like hand washing as a method to slow the spread, which you've already talked about? So again, the government has to step in from the grassroots to really address why people should all of a sudden start washing their hands a lot more than they used to before. And this comes from, like, I want to say, besides the public health people, but people actually in the media. Is the media in Nigeria helping to spread this word at all?
Yes, the media is doing a fantastic job of, you know, trying to get the news, of course, with the assistance of private organizations too. A lot of advertisements, a lot of clips on the, you know, video clips. Then various organizations are also rising to the occasion. For instance, the Nigerian Medical Association, Medical Women Association of Nigeria, the Nigerian nurses, you know, health workers all over, you know, in their numbers going to the community. 2 weeks ago, we were in the marketplace with medical women, you know, and teaching them about hand hygiene, sanitation, and distributing masks, you know, good. So yeah, and that is one thing that we need. Everybody needs to own this struggle.
Yes.
You know, and not leave it to the government, because if we do, I mean, we're not going to make much progress. Exactly. But we have to police ourselves. We have to police ourselves. We have to encourage each other. Right. You know, I was somewhere today, and I asked the workers in the facility. I said, why aren't you wearing your masks? You know, so that's the kind of thing that needs to be done. Yeah. Everybody needs to ask the questions of the next person. Right. Wear your mask, wash your hands before you come into this place, sanitize your hands, you know. So with that, we can make some progress.
And somebody's asking, and this has been a highly contested and asked questions, what is the relationship between 5G and COVID-19? I've had people on the show that in the past that have also addressed this. But from what I know, and well, we all know, COVID is respiratory and 5G is radiation related. So, Doctor, can you touch a little bit on that?
Yeah, I want to be nice and say that, I would have said, I don't know why this question comes up again, because I mean, the science doesn't lie, you
Right.
know.
Exactly.
I'm not a physics professor, but I did, some physics to get into medical school, and I know that, I mean, if we have been using 4G successfully,
Yeah.
without having nausea and vomiting and all the other irritating things that are supposed to come with 5G. 4G to 5G is just a step,
Right.
So I really don't think people should be scared of it.
Yeah.
Coronavirus 19 is a viral infection.
Yeah.
This is the science, and I mean, that's what I can say about it.
Yeah.
They're not related at all.
And I know Facebook has been cracking down on people posting 5G related information. I know, sorry, somebody's saying the echo. We have our headphones down just so it's not too echoey. And Doctor, your audio is down, but people say they can hear us. I'm sorry, Obi, technology. We're trying our best to get the information out as much as possible. But yeah, Facebook has been cracking down on people posting 5G information and related to COVID-19 and taking those information off the web. So Dr. Okuchi is asking, is it possible to keep track of the death related to COVID in Nigeria?
Very good question. And unfortunately, the quick answer would be no. Now, this is because we already have challenges with data in Nigeria. Like when we talked about the Kano situation, we said that it was even the grave diggers that raised the alarm,
right.
That they were tired of digging graves. Now, this tells you that there is hardly a, death registration in that part of the country.
Wow, yeah.
So but I mean, this is a great opportunity because, I mean, we need to look at the silver lining in every cloud. Yeah. This is a wonderful, this pandemic, I see, has presented so many opportunities to Nigeria. For instance, the issue of giving stimulus to poor, people in the population. I mean, that was a 100% gold opportunity to ensure that people are banked. Ask them, if you want to get the stimulus, go and open a bank account, get a BVN, a bank identification or verification number. No, it wasn't. They were giving cash. Okay, so now this issue of registration of deaths, this is another time that we can ramp up information about the importance of registrations. We do not have any proper or very, very good registers for deaths. Even for other deaths, all-cause mortality, we do not have. It would have been a very good opportunity to improve, on this.
So are you saying that
some places in Nigeria are better than others?
Right.
I mean, with respect to that, some are more effective than others with registration data and all that, but
I mean,
on a national scale, no.
I know with the voting and the PBC, they have a way of dealing with that. I don't know. I mean, we've seen how that's gone, but can they model almost that same way to, because like, here in the US, to track us, everybody has a social security number. So that's an easy way to track everything.
I'm sorry, I didn't get the first part of what you said.
Oh, I was saying in terms of tracking a number of deaths in Nigeria, just like everybody has like a voting card, which I believe is called a PVC, right? Am I saying that correctly?
Everybody?
Well, not everybody,
no, not everybody.
Right.
A lot of people do not have. A lot of people, even voting cards or even national identity cards, and those are the issues. So we don't even know who is who and where anybody is. So I mean, I would say it would be virtually impossible at this stage to actually track COVID-related deaths. Of course, NCDC is doing a good job. The state governments are trying their best. But I mean, once someone gets lost in a population where death will not be reported, and the culture of the people is such that they will bury the dead immediately.
Yeah.
So then what happens?
Yeah, exactly. Somebody's asking if recovery from COVID-19 isn't a guarantee for immunity, what then is the way forward, keeping in view the conspiracy surrounding vaccination? That's a great question. I know for me, yesterday, as a matter of fact, I went and took an antibody test just to see if I had the COVID or not. I didn't have any major symptoms. I'm asthmatic, and at one point, between, I want to say February and March, I used my inhaler more than I've ever used, and I've had asthma since I was 12. So I went and took the antibody test yesterday, which will take about 3 days, and that testing is free, just to see if I had a bet. Of course, it's the doctors told me it's partial immunity. Nobody knows if it means that you're not going to be susceptible to, getting the virus again. So talk to us a little bit about that. What is the way forward before vaccination gets here?
The partial, well, with respect to immunity after coronavirus infection, the jury is still out.
Right.
And I was listening to a report from South Korea also, where some patients who had actually had coronavirus infection and recovered were tested again, and they were said to have been positive.
Right.
But I mean, that was some time ago. But I think yesterday or day before yesterday, there was information that that it wasn't actually, was a false positive.
Oh, okay.
Yes. So I mean, like I said, we can't really say for now. It's a novel virus. So people are studying. I mean, research is going on every minute of every day.
Yeah.
Around it. Now, of course, the gold standard is going to be vaccine. And we hope and pray that this will come out in good time. But in the interim, people who are susceptible to the worst forms of coronavirus infection just need to remain protected.
Yeah.
The elderly, those with comorbidities such as hypertension, diabetes, and asthma, like you mentioned. Right. One of the doctors that passed away, unfortunately, in Nigeria, needs to, I mean, he was an asthmatic patient, and that was probably because he was young, just 45 years old, but I believe that his history of asthma was contributory, so people with comorbidities just need to remain protected.
Yeah.
Boosting immunity can be done in so many ways, especially good nutrition. Yeah. Especially good nutrition. So, and at the end of the day, the reality is that a lot more people are going to get the infection.
Yeah, and they're predicting there might be a second wave. Well,
I mean, it's if there's no vaccine, that is exactly what's going to happen. For instance, where we are in Nigeria, we're still ascending the curve,
right? And
we have eased restrictions. What do we think is going to happen?
Exactly.
It's so
it's not looking good anywhere with the easing of restrictions anyway. And again, thank you everybody. If you have any questions, please type it in. I hope the doctor has been able to, I know she has been able to address the questions that we've been asking her today. Before Instagram kicks us off, please ask any questions, and people are agreeing with you. They said the whole essence of data keeping, record keeping, as well as head counting, such that they have the database of everyone in the country, to say the least. Okay, so they're talking about, so somebody's saying, what practical ways do you advise can be used to dispel the belief of a good number of Nigerians, particularly in the rural areas, that have COVID-19 is not real? Yeah.
Thank you for that question. Again, I will refer to the case of Kano.
Yeah.
Now, I know that a number of Nigerians must have seen the the videos that were circulating about people washing their hands into bowls of water, and drinking it.
Oh, I didn't see that one. Seriously?
Okay, so that went round in defiance of coronavirus. That was way before this Kano State surge.
Wow.
And I mean, again, I would say that the only way is to connect properly with the people.
Yeah.
You need to get their trust. There is an innate distrust, of course, of Nigerians to politicians, leaders. I mean, I'm a doctor, and on a number of my professional platforms, people ask questions like, so what is the government doing with all that money? Are we sure they're not cooking the numbers so that they can get, some more aid?
Right.
And I would forgive Nigerians for feeling that way. I won't blame them.
Right.
No, because I mean, precedent is what we're looking at what has been done in the past. So, but now to do, we need to connect with the people, and we need to come through people that they trust, they believe in.
Yeah.
If the Almajiris, the little boys that go after the religious clerics in the north, and then they also beg. So if they listen to their clerics and their clerics wear masks, they will wear masks.
Exactly.
So we have to identify leaders of thought in these various communities, because using the hard stick, like policing them,
it's not going to work.
Locking them up, it will work only when those authority figures are around. Once they turn their backs,
it's only
Nigerians will do what they want to do.
You want something long term.
Exactly, and I think that's just basic human nature.
Yeah. So, thank you guys once again. I want to ask the doctor at least, where do you see Nigeria in the near future with the virus? In your educated opinion, do you foresee it getting better or worse? I mean, I guess that's a clear answer to that, but I like to hear from the professional too.
Yeah, with my church mind, I would say, I hope and pray that it gets better, but it doesn't look good.
Yeah,
it doesn't look good.
Yeah, that's quite unfortunate. So, thank you all once again. Before we start logging off, thank you all for the questions and the input. This has been a very, very informative show. I know we only have like a short period of time, and I'm sorry for anybody that tried to join us on Zoom. We had like a little bit of mishap last time, and I didn't want to take that chance again today. Somebody's Discipleship 80 said, thank you both for your contributions. May God bless your efforts and keep us all safe. So,
amen.
Amen. Dr. Foluke, how can, okay, before I get to that, Obi's asking, hopefully it doesn't hit Nigeria. If it really hits hard, it will be beyond a pandemic. And like Dr. Foluke said, in a church mind, let's hope like it doesn't, because science, like you said, doesn't lie. Based on what we've seen, is not looking good. But we just got to hope and pray that we all come out of this alive, and that we are all going to be able to account for all our family members and friends at the end of all of this. This is being compared to the Spanish flu of 1918, which killed a lot of people. So let's just hope that a vaccine, which is looking likely, they're saying is going to be another year and a half from now before a vaccine becomes available. So, and that's really scary. Somebody said, what do you think of the Madagascar cure? Do you know what that is? I don't know what that is.
Okay, some people in Madagascar have come up with herbal remedies to treat coronavirus infection. What do I think about it? Well, I know that herbal medicine can be very effective, and I know that a number of orthodox drugs actually took their roots, and their source from recipes and traditional preparations that were handed down over in fact, even the anti-malaria that I was telling you about, is actually a Chinese drug,
right?
That came. It dates back thousands of years, so,
Okay.
and it's being used for malaria now. But again, I will say that before a drug is approved as a treatment, there are steps
Of
to be
course.
followed, and this hasn't followed. So in my own opinion, I would not consider it
Of course.
as something that should be propagated.
And one last
Research
thing
can go on.
yeah, one last thing I want to add, and I'm sure people in Nigeria wouldn't do this, but I know Trump talked about people drinking any kind of bleach and all that kind of stuff. So I know people in Nigeria are not going to do that because that's definitely not the way to go. Drinking any kind of bleach will take you out.
I haven't heard of any reports of anyone in Nigeria that did that.
Oh, good. Thank you. That's great. That's great. So, Doctor, please tell our viewers how we can find you. How can we support you or your practice here, online, offline? Tell us, because we really want to help and support and keep our medical.
Okay, so I practice. Thank you so much. I practice in Ibadan, in Nigeria.
Okay.
I'm a private practitioner. But there are a few things that are dear to my heart. My Instagram, of course, I think is going to show my handle, and on Twitter, I'm at Dr. Folu as well.
Okay.
So a few things that are dear to my heart right now are hand hygiene.
Mm-hmm.
In the wake of this pandemic, I've come up with a very cheap non-touch hand washing system. A number of them exist in Nigeria that have been developed by different brilliant people. So I just came up with one with my local welder. Okay. And I'm working on raising funds to make sure that this is available in marketplaces,
okay,
and public places, churches, schools, mosques, places like that. So we've started already. I mean, I've started.
How are you raising funds for that?
Well, I'm about to start. I started under my own steam. I've given 2 out already, and in marketplaces in Ibadan. Okay. So I'm gonna think up a way. Maybe on Instagram I could drop details and show pictures. Great. I think I posted it on Instagram already. Pictures and a video of what has been done. So people can just go there and have a look and see. And
have a look, and also if there's a way to, if you are raising funds where people can make donations and stuff, that would be great. So when you post that, tag me and I'll help to spread the word on that.
All right. Thank you. Thank you so much.
Thank you. Thank you once again, everybody. Thanks for joining us. I am going to post this on YouTube, so it can live on YouTube if you want to catch it later and this will also on Instagram. It will live for the next 24 hours before Instagram deletes it. Yes, and people are saying yes, they want to donate. So if you can get that up and running, we'll be glad to support you. Thank you so much, Dr. Folu. Wherever you are, please give her a round of applause because she did awesome today. Awesome job.
Thank you.
And if you know anybody in Nigeria, anywhere making a difference in the community, coronavirus, before coronavirus, after coronavirus, please direct them to me. I'd like to highlight them on the show. Okay. All right. Yes, they're clapping for you on Instagram.
Thank you.
Yeah.
Thank you so much.
She did a great job. Thank you so much. And please, everybody, be safe where you are. Stay prayed up. Social distance. Use your mask. When we
take responsibility.
Yeah, so you're responsible for yourself and the next person. And if we keep that in mind, things are really going to start getting a little better with this virus. We don't have a vaccine in sight anytime soon, so we have to take care of ourselves and each other. All right, everybody, have a good one. Bye.